Part 2, Episode 2 will demonstrate how a pharmacist provides a medication assessment follow-up appointment with a patient having a relatively complex medication regimen. Sometimes, during these follow-up appointments, it is necessary to not only monitor the effects of previous changes, but also to complete the annual assessment and to address any lower priority drug therapy problems that were previously uncovered.
Good afternoon. I'm Ralph Morazic. I've
Okay.
got an appointment with Harry for a follow-up.
Okay, for sure. Can I get the spelling of your last name?
M-A-Z-U-R-K.
Okay, yeah, we have you here. I'll just grab Eric for you. See
Good,
if
thank
he's
you.
ready.
Yeah.
Eric, are you ready for your appointment with Ralph?
Yeah, sure. I'll be right there.
For sure. I'll just bring him to the office. Just this way, please.
Thank you.
So, Ralph, welcome back. Nice to see you.
Good.
So why don't we just start with a recap of what's gone on in the last month? Now, last time I saw you, we were making plans to switch your warfarin for another medication.
That's right.
Okay, and how did that roll out?
That's after I saw the doctor, that went ahead, and it's
Okay.
been gone. They've done that quite a while ago now. I guess within the last 2-3 weeks, it's been all completed.
Yeah.
And it's been working great. It's
Great.
the new anticoagulant is in the blister pack, and it's no problem remembering to take it.
Excellent, that's awesome.
Yeah.
And in terms of the amitriptyline, we were trying to get rid of that one, right? And
Yeah, again, the doctor agreed, and we have been reducing the dose, and I think we're finally off of it completely now.
Great, that's
Yeah.
awesome.
Yeah.
And how about the constipation, dizziness, lightheadedness?
Do you know, I can't say that I've noticed them at all anymore,
That's
so
excellent.
I think it's been working very well for that as well.
Great, great.
Mhm.
Well, that's excellent. I'm very happy to hear that. So now you know that we've got you back in here. We got a little more time to delve into those other issues that we didn't have time for last time.
Okay.
So why don't we start with high blood pressure? So since I saw you last time, I had the opportunity to talk to your doctor about getting the records of your blood pressures over the last number of months.
Yeah.
And from what he sent me, it looks good. Like your blood pressure is well controlled. You are on that hydrochlorothiazide to help with that, and I think that's something you should continue on for now anyway, because the blood pressures look good, but it seems to me that it's still helping. It's still doing what it's supposed to.
All right. No, that's-
So that's something certainly we want to follow and watch with you.
and there's no side effects with that as well, because you mentioned we had side effects with the others. There's no side effects with this one?
There can be. There's pretty well side effects with almost any drug that you can name. So certainly there can be. With the hydrochlorothiazide, we might be looking at similar dizziness or lightheadedness
Oh, okay.
that you were feeling with the amitriptyline. But you say that's
No,
resolved
no,
now.
that's,
hey,
that's
an issue.
resolved, so
Okay.
that shouldn't be
Yeah.
a problem then.
Some people will find with the hydrochlorothiazide, it's a bit of a nuisance. They'll call it a water pill because it makes you pee, right?
Mhm,
So, not really a side effect, but it's just kind of one of the ways that it works, right?
Yeah.
So,
No, that's fine by me.
okay, it's not an issue for
Oh.
you, causing any issues with urinating or anything.
No.
Okay, okay, great. Well, that's great. Yeah. So as I say, I think we'd be happy to have you continue on that one at least for now, but we'll continue to watch
Okay.
your blood
Yeah,
pressure
sounds
for
good.
any changes if maybe you don't need it in the future, or if
Mhm.
we need another medication to help with high blood pressure if it's not controlled
Right.
going
Yeah,
forward.
I understand. No,
Okay,
sounds
great.
good. Yeah.
So next, why don't we move on to your high cholesterol?
Okay.
Okay. Okay, Ralph. Well, I think we've covered all of your health conditions and the medications that are associated with them. So at this point, do you have any burning questions that are still at top of mind?
No, I'd like you to know that I really do appreciate everything you've done for me,
Oh,
because
great.
that's made quite a difference already. So, no, I think we're doing good. Thank
Well,
you
you're very
much.
welcome.
Thank
My pleasure. So just to confirm then, other than the 2 changes we made from last time, the warfarin and the amitriptyline, all the rest of your medications have remained the same, is that right?
That's right, yes.
Okay, great. In that case, before I let you go, what we like to do is the very last thing is called a review of systems.
Okay.
So essentially what we do is just kind of go head to toe and ask you, if there's any issues with that particular part of the body that we might have missed when we were chatting about everything
okay.
else,
Mhm.
okay? So to start, we'll start at the head. Any concerns at all with your vision or your hearing or your sense of smell or your nose in general?
No.
Congestion or anything?
No, not really,
Okay,
no.
yeah. Okay. What about any breathing issues? Cough or shortness of breath? Nothing like that?
No,
Okay.
not at all.
Okay. What about any stomach issues? Upset stomach or...
Now that you mention it, yes, I still have that intermittent heartburn. It still keeps coming at me.
Right. That's right. And we knew about that, didn't we? Because you're on the pantoprazole.
Yes.
Right,
okay.
right. Okay. Okay, so tell me a little bit more about your use of the pantoprazole and the stomach issues you have.
Well, the drugs I'm just using out of the blister pack, but I'm still getting quite a bit of heartburn. It's just real burning sensation.
Mm-hmm.
Now, in my mind, and I'm not sure it's right, I'm associating it with my arthritic drug that I'm using.
Okay.
Ibuprofen. I'm not sure because it seems if I take a large dose of that, then I have to deal with the heartburn. If I don't take a large dose, I deal with the pain of the arthritis.
Right. You know what, Ralph? That's a really good point because, as I recall, you were taking quite a bit of that ibuprofen, weren't you?
Yeah.
2 of the 400 milligram tablets.
Every 6 hours.
Every 6 hours. Yeah. See,
been doing
that's
that for quite a while.
That's a pretty hefty dose of the ibuprofen,
Mhm.
and it is one of those medications that can upset your stomach. It can be quite hard on the stomach. And in fact, it can actually increase your risk of having a bleed or a stomach ulcer.
Oh, really?
Yeah, so I'm glad we kind of caught this one because that's something that we can certainly make a change today to help reduce your risk of a serious complication like a bleed. But also we want to get a handle on your pain, the arthritis pain, because if we get rid of that ibuprofen, certainly we need to replace it with something.
Yeah.
So before we get into that, I just want to confirm with your stomach problems and the pain associated with it. Do you ever have any vomiting or any blood, either vomiting blood or blood coming out in your stool?
No.
Okay.
I haven't had any of that.
Okay. Do you ever have difficulty swallowing where it feels like food going down is really tight or anything like that?
No.
Okay. Well, that's good. Okay. In that case, what I'd like to recommend is maybe we get rid of that ibuprofen and talk about using that Tylenol a little bit more. I think last time when you were in, you mentioned that you had used Tylenol.
I tried it a couple times, but I didn't notice that it did much, so I didn't. I just went back to my ibuprofen.
Right. Okay. Now, where we find the most success with Tylenol in treating arthritis pain is when people take it consistently, kind of around the clock. You take it, before you're sore, rather than just trying to treat, when the pain pops up and take a Tylenol. So what we find works well is to take it, scheduled several times a day, maybe 4 times a day, depending on what type of Tylenol you get. I don't know if you've ever seen the Tylenol arthritis. It's a special formulated tablet that has releases some Tylenol right away to deal with your pain right away, but it also is long lasting. So it lasts for several hours so you've always got a certain maintained level of pain control.
Oh. I think I've seen it advertised, but I have never paid attention to it.
Yeah, okay. Well, that's something that I think might be useful in your case. Particularly because it doesn't have that same risk of a stomach bleed, and it's much better tolerated on your stomach than the ibuprofen is. It can be that ibuprofen can be quite harsh. So if you're agreeable to it,
I'd be willing to try it.
Okay, great. Then my recommendation would be to stop that ibuprofen altogether and get yourself some Tylenol and take it regularly, every day, kind of around the clock type thing.
And just take one tablet each time, or?
Well, it'll kind of depend on your pain. So you can kind of start with one tablet at a time,
Mhm.
depending on how bad your arthritis pain is. Some people might take one extra strength and take that every 6 hours or so, or every 4 hours. But you'll be the best judge to see if your pain is well controlled or not.
Okay, that sounds good.
And as I mentioned, that Tylenol arthritis, because it lasts longer, you don't have to take it as many times during the day.
Okay.
So
No, I'd be
that's-
sure willing to try it.
Okay,
Okay.
great.
Mhm.
Well, yeah, I think that's worthwhile trying. And maybe we'll just finish off the review of systems
Sure.
here then, if that's all right with you.
Mhm.
Okay. So skin. Any issues with your skin, with dryness or cracking or itchiness, anything like that?
No, not.
Okay. What about metabolic conditions? Okay, Ralph. Well, I think that's pretty well the end of our assessment. So what happens now is I'll send a note over to your doctor just to let him know about the changes we talked about, the Tylenol and the ibuprofen today, just so that he's in the loop of what we've the changes that we've made today.
Okay.
And what I'd also like to do is either give you a call in maybe a week or two, or maybe have you call me if these changes aren't doing the trick for you. If you're finding that the Tylenol is not treating your pain adequately, please give me a call and we can talk about what other options we might have. And if I don't hear from you, then maybe I'll give you a call in a few weeks' time and just check in to see how you're
Yeah.
doing.
If you'd like to, that's fine, but I think you can assume that if it's working for me, then we got a horse. Let's go with it.
Okay,
Yeah.
fair enough. All right. So then in that case, maybe we'll talk about follow-up in a year's time.
Yeah.
We can do this process again.
I sure appreciate it this time. Yes, I'm very willing for that.
Great, yeah. So we'll be in contact with you, probably send you a phone call or a mail out or something to set up a time for you to come in again in about a year, and we'll tackle everything again at that time.
Well, thank you very much. I do appreciate it. Thank
As
you.
demonstrated by this video, the pharmacist began by confirming the success of previous changes to drug therapy. After confirming these changes were successful, and that no new drug therapy problems had been identified, the pharmacist continued with the assessment of the lower priority medical conditions, including high blood pressure and dyslipidemia. Additionally, the pharmacist decided to conduct a head-to-toe review of systems in order to ensure that no new medical conditions have gone unseen. During the review of systems, the pharmacist asked brief questions about each body system to determine if there were any issues existing that required treatment. The pharmacist detects a minor drug therapy problem during this process and responds with recommendations to improve the symptoms of heartburn. The need for multiple follow-up appointments may be more likely when providing medication assessment services to patients with complex medication regimens. Even in cases where no new drug therapy problems are identified, the medication assessment services provide an opportunity for pharmacists to meet annually with patients to provide a refresher course on their medications, simultaneously while fostering strong relationships, increasing patient involvement in their own health, and producing positive outcomes.